I think somebody who definitely is motivated to learn does better in a hybrid environment. So somebody who's a self-starter, well motivated to learn and push themselves tends to do well. We do see increased diversity, both ethnic and racial diversity, also socioeconomic as well as geographical diversities. But again, I think go back to is it grit? Is it resilience? What is it? I think it's the motivation to be a learner.
Hi, welcome to the Orthostatic podcast. My name is Eric Robertson, and I'm really pleased to be joined today by the wonderful Megan Donaldson. So Megan is a longtime acquaintance of mine, a good friend, and she's currently serving as the Department Chair of Rehabilitation Sciences Division at the Medical University of South Carolina and Hybrid Director of DPT. Also, and importantly, Megan is the current president of the American Academy of Orthopedic Manual Physical Therapists, affectionately called AAOMPT by pretty much everyone. So, Megan, welcome to the podcast. Really glad to have you on and glad to talk all things OMPT.
Thank you, Eric. I appreciate it. And it's great to see you.
Yeah, great. So you've been president of the Academy. It started last conference, right? So October. So we're approaching like a year mark.
Yeah, I'm like 9 months.
Yeah.
So it's just about enough time to have a baby, right?
Yeah.
I'm learning
it's formed
some things.
now. Your mission is formed.
That's right.
All right, good. And I guess that's maybe a good spot to start. I think, like a lot of people, you have your hands in a lot of different things. So I was thinking about all the things we could talk about, and it was like it just kept unfurling. And so I said, well, let's start with this one thing. Let's start with AOPT, because this is a podcast from the Academy of Orthopedics. And we're talking about a different organization, but I think there's probably a lot of symmetry there. And so, not everybody in the Academy of Orthopedics is a member of AOMPT. Although there could be a good argument for that, but what's the symmetry there? How does that work together?
Actually, it's a great question. So, orthopedics is in the name of orthopedic manual physical therapists, right? So when we think about our bigger umbrella, the bigger umbrella is orthopedics. We all have a passion for orthopedics. Where I think our separations exist a little bit is that actually orthopedic manual physical therapy is a bit of a subspecialty within that orthopedic section. So now you're kind of getting people who maybe have been trained a little differently, thinking about, of course, always orthopedics, but a little bit different in the reasoning aspects and when hands go on, when hands go off. Again, in our space, we have both residency style models in orthopedics, but then fellowship is in OMPT. And so that's where I would say our organization's passion has been since its inception, really is focused in the education, high level quality of OMPT clinicians who've either come through residency and or whatever pathway they have gotten there, but have ended with fellowship, which is this high level clinical reasoning, mentored experience that I will tell you, our academy of people are just top notch. And there are a lot of, I call them the crossovers, right? So I'm an orthopedic section, I'm an OMPT, and I love both houses. Where we're better is when we do things together, right? And so it's not a divided membership, it's a unition, and really coming together and uniting us around topics or agendas or things that we need to get more momentum. We have started to do some of that, and I think we'll just continue to build on that.
Great. So, I was reading the publication that comes out from AOMPT, the hands-on newsletter, like a good member. And so I was pleased to see in there it talked about the relationship that APTA has with AOMPT, and that's something that maybe not a lot of people understand what that is. But there's a formal link there, right?
Yeah. Yeah. So there was a long history, right, of this organization. And it actually used to be a united, we used to be part of the orthopedic section. There were pieces, I would say, that we didn't find our complete home. They valued really more of this formalized education, so fellowship, well before it was popular. And that kind of a test, that high assessment, that high quality assurance required them to kind of form their own organization because they couldn't find quite the home that they wanted within the orthopedic section. So years ago, that's why the founders kind of subsectioned themselves into this group. They've come from all different types of educational backgrounds, again, different philosophies and schools of thoughts, but they united together in forming AOPT. What happened then is that we wanted to definitely have a representation at the world level, so internationally. And in order to do that, right, it recognizes one nation's governing body, and so that would be the APTA typically. But because the specialty that we're within, which would relate to IFOMPT, which is the orthopedic section, so to say, at the world level, we needed to have a representation. And so OMPT, natural home, was with AOMPT. And so APTA and AOMPT were able to unite together under a memorandum of understanding, which had been continued for years. That we have this relationship with IFOMPT. We have our home in the United States. We are good members. We're good stewards. We have most of our fellows have to be members of APTA in order to be a voting body and have us be recognized at the IFOMPT level. So it is a subunit of the APTA in some regards, that our members are the same, even though this is I would say, a volunteer organization that is outside of the APTA. So we just signed, actually, Dr. Roger Herr and I signed our collaborative agreement at the recent House of Delegates, renewing our contracts with one another through 2027. And that means that we have an ongoing relationship in which the APTA and AOMPT still have a collaborative, recognizing our roles to make sure that we can work together and still promote OMPT going forward internationally.
Yeah, that's great. Congratulations on that.
Yeah, thank you.
It's I have a little side anecdote, and I know you're the interviewer here, but this is a story that I always think about when I think about the forming of AOMPT and how it relates to that international stage of IFOMPT. When I became the director of the Kaiser Fellowship, I walked in, and here's this office, and it's trying to somehow replace or take over after Carol Jo Tishner retired, and I'm going through the stuff, and there's things, and she was a paper person, a lot of papers, and so I pulled up this blue binder, and it just looked like nothing, and I opened it up, and it was the copy of the application for AOMPT to IFOMPT membership, just hanging out there, and I felt like I was holding this tome of orthopedic history in my hand. It was pretty exciting.
Well, I mean, thinking about us being a member organization and what's so unique, and I'm sure we'll get to, but when you get to go to the world level and you see what it takes to be a part of this organization of IFOMPT, and I would say its history, right? And to see some of these countries so desire to be a part of that and the work that they go through, to think that we were some of the early adopters back in the day, it is very prideful. It's very prideful. We've had really, really rich founders who, in terms of their knowledge, their skill, their belief in this organization and what we could do as a country to advance OMPT, we're indebted to their legacy.
Yeah, and what's interesting is, you mentioned different schools of thought from manual therapy, right? And so that's one of the interesting things to me, is that when you look at who the founders were for IFOMPT, they're all different, tracks, if you will, but also they're international in a sense too, right? Almost all of the founders have some connection to something that's not here.
Right. Right. And so when you look back through the AOMPT history, and it's actually on our website, it gives you a little bit more of a detailed history of where all the founders came from, and, how they had to unite together. And that's what I think, I have to say, the spirit that I have is probably that, which is that I believe in uniting, not dividing. I believe in leveraging and building synergies, not finding our own pathway and marching forward, right? We can do that, but the journey is so much better through collaborations. And so that's what they did all those years ago. They figured it out to figure out ways to join together and move forward together, uniting with other organizations, which was IFOMPT at the time and APTA. And so that was the legacy handed to us. And I believe in it. I fully believe in it. And I think we can only do, a better job of modernizing it and making it even more accessible to others that are just coming into the profession. Really, one, leaving the legacy and marching it forward, and modernizing it.
Yeah, that's great. Like, what does modernizing it mean?
Yeah, so hopefully you've read at least the paper, and Jason Silvernail. In fact, I had an opportunity to do his podcast. And the modern definitions are really interesting piece where it has different facets that some people think it's just about a technique, and it's so beyond that. What OMPT is, orthopedic manual physical therapy, is beyond just a single technique, right? It's the reasoning, it's the integration of patient-centered care, it's the application and understanding the whole context of the patient, whether it's pain or mechanical. um, and I appreciate what that means. At times our hands are off, and is that so OMPT? Well, certainly. I mean, we're doing the reasoning aspects of that, right? And so Jason Silvernail et al.'s paper really provided a nice framework for us to really step back and think about what manual therapy is in the context of OMPT, and not just a single technique that I think, you know, from a social media perspective, over the last 5 years has really kind of created a negative stigma that we are working very hard to kind of reshape the narrative for what it was always intended to be and the way it was always written to be, despite the negative social media attention that it received. So that's what I mean by modernizing it.
Yeah, so there's a good paper to go check out. Um, yeah, and I've heard you say this phrase now a couple times, this hands-on, hands-off um, thing, right? So that sounds a little familiar, like a different podcast, maybe even.
It's a different podcast, but that's the podcast by AOM. So we have a collaborative with the Center of Excellence at Duke in manual manipulative therapy, so CMET, and good colleague friend Chad Cook, and Derek Cluley and I collaborated in order for AOM to have that as an opportunity for us to continue marching forward, much similar to what you guys are doing. Again, we're promoting orthopedics here, and a specialty side is the orthopedics with the manual physical therapy intention, and that's what that hands-on, hands-off podcast is doing, is allowing us to kind of take that a little bit further too.
Yeah, good. So another thing to go check out, where
Absolutely.
you're just providing here. This is fantastic.
Resources,
Yes.
resources.
So yeah, let's talk like big picture about like your mission, as president with the academy. So some strategic planning going on. Like what are some of the agenda points that you'd like to accomplish?
Yeah, well, so that strategic plan has probably been about 3 to 4 years actually in the making. I was conference chair, and so we actually hosted World Cafes for about 3 years. And the World Cafe was a strategy that I held at the conference to really brainstorm with our attendees priority areas. And so we were able to kind of ground root ourselves amongst, so the board members were at the tables listening to our members and really hearing concerns based on subtopic areas. So then we were able to take that forward last year. And Jason Rodegaro and myself did the strategic planning meeting with the board. And it was a wonderful opportunity for us just to come together and hear about where we are. But obviously, we would need to prioritize our memberships. We are a membership driven organization, similar to what AOPT is. But without our members, we really are nothing. And I mean that. So, what do you give to your members? And so, I think sometimes we step back and we think about, oh, well, we give them this and we give them that. But the reality is, we're not as giving as we want to be. And so, thinking about developing more resources, more opportunities for networking and collaboration. But in order to do that, we have to have some structures in place. So, improved organizational efficiencies within both our committees as well as around our inner workings. We also need to have our collaboratives, which includes at the national level and the international level. And those are really important as well. So, when we step back and we think if we're member driven, we need to make sure our collaboratives are strong and our efficiencies are strong, because that to me is how you communicate. That's how you organize. And I'm a structure girl. So honestly, I'm really good at creating processes and structures in order to make sure things tend to flow a little better. And that's been the work we've been focusing on right now. And probably over the next 5 months will still be the focus. And then it will transition into a different phase. But yeah, for now, we're in, I would say, We officially approved the strategic plan in February, and then it was implementation and rolling that out. So we're in a good stage of quarter 2 and looking like we're targeting some good things right now.
Yeah, that's great. So almost like communication is the bottom line, right? Connecting more to the members.
Absolutely. Yeah, connection happens in multiple ways and not just at conference, right? So Eric, you're hosting the podcast and we're doing the similar thing. But why? I mean, it's so members have a touch point, right? And that they are not just having to go to a passive website, that they get to hear us and see us and hear the awesome humans that we bring on our shows. But to me, this is just leveraging what great things we do and giving people resources and connection points.
Yeah, great, great. So, you're talking international a few times, and so let's go back and talk about that. I think the last time we saw each other in person, you were in Switzerland, we were in Switzerland, and you were hosting a 4th of July party. I think you had taken over a hotel, and we're having a good time.
Well, I tend to do we tend to do that.
Yeah, I was trying to put it on you, but okay.
No, we
Fair.
tend to do that. So I will say AOMPT decided to make sure that the US was celebrated on the 4th of July. And we opened it up in terms of inviting some of our international colleagues to celebrate with us. So it wasn't just a US party, it was like definitely had an international flavor to it. And we also got to celebrate the former President Elaine Launeman's birthday. So it was a double day, a celebration and a birthday party at the same time. So, yeah, we had a wonderful time doing that. And, the international relationships, I will just say over the last probably 5-6 years, have ebbed and flowed with the negative social media relationship
Interesting.
because I think that there's a flavor that tends to get absorbed a little bit more at different countries, whether or not manual therapy is like the go-to technique or if we have an appreciation for it. And some people, again, some different organizations adopt some of the social media challenges differently. And so, I think I look forward to having the opportunities to start to build and really contribute to where IFOMPT is going. As a member organization, that's one of the largest. For IFOMPT, I think that the US is really positioned well to be strong supporters and leaders with our colleagues at IFOMPT. And that will be the mission that we choose to go forward with. And so we've had some really nice conversations with the executive committee that was just elected. And so that's really great. And in fact, fresh off the press, will be coming a letter from AOMPT and the IFOMPT executive supporting that we will continue with a collaborative, ensuring that manual therapy is a focus of the conferences going forward, even for IFOMPT. So, we're just doing the right thing. That's what I believe. I think our members want this, and I don't think it needs to be politically swayed in either way. I think we really do have a good space here, and staying very collaborative and keeping OMPT at the focus of what we do and how we offer it to our patients is critical.
Yeah, I want to back up just a little bit in terms of the focus of the conference, right? So, was that a concern from the community that the IFOMPT conference wasn't as manually focused? Like, what drove that statement?
Yeah, so there was actually a motion that came forward at the AOMPT business meeting with some concerns. And so that became a motion that ended up coming forward. But I would even back up before that is that there was a trend that was seen, that we are trying to go more towards a musculoskeletal focus. Again, let me just restate at the world level, there is not
Sure.
just an orthopedic section like what we have in the US or the Orthopedic Academy. We have IFOMPT, which is a blend of this. And so it's both orthopedics and manual therapy represented at the world level. And so it's different. And I think sometimes, right, people have to appreciate that that's their job, is to represent both houses, where AOMP's houses OMPT and orthopedic section or academy right now is really focused on orthopedics, and there's enough for two people. I mean, truly there is. And so when you go to the world level and conferences tend to focus just on orthopedic topics and manual therapy starts to become less of a focus, there was some concerns. And this is in the same time that, they were choosing to move forward with a name change. Again, it had garnered support over the last 4 years, but I would suggest that It creates concern, right? During a time that social media has a negative presence in the use of manual therapy. And so certainly I would step back to say, what's our legacy? What's our charge? And how do we keep patients and their outcomes at the forefront of what we do? OMPT belongs at the table, and we want to make sure that it stays strong in the future. So conference security being that we want to make sure manual therapy is still at conferences for people to learn from.
Good. So there you are advocating internationally for manual therapy. You mentioned the name change of IFOMPT, and so a lot of people might not know that IFOMPT subtly changed their name at this last business meeting.
That's right.
And so the IFOMPT used to be the International Federation of Manipulative Physical Therapists, and now they changed it to the International Federation of Musculoskeletal and Manipulative Physical Therapists,
Manual.
right?
Yeah,
So,
I think.
or manual,
Yep.
manual.
Yep.
Yep.
They got
manual.
rid of manipulative. Yep.
Yep. So subtle name change, and I think it kind of reflects what you were just talking about in terms of room for both at the same spot, right?
Yeah, I think we should not fear a little modernization. I think it's okay. I think as long as we keep at the forefront of our focus, our legacy and charge, and the real intention of OMPT. Again, I think that if we know what we are aiming to do, politics shouldn't get in the way. I think there's opportunity for people to unite together around causes and certain opportunities, especially keeping both organizations really strong. And to me, this was a space that needed to have some conversations. And I feel very, very privileged to be able to have been in Switzerland, have the conversations, find value in the executive committee at IFOMPT, welcoming those conversations and moving us forward.
Yeah, and everyone got to play an Alps horn. So
That's right.
Yeah. So it was some good times there. That was like a bucket list for me. The Alps horn. That was.
It was amazing. All the things that I could say in a summary, which is just, if you've never been to Switzerland, you should go.
You should
It's
go.
absolutely an opportunity. You wouldn't want to miss it.
Yeah, good. So talking about modernization, I want to kind of shift focus. We've been talking about the academies. So I want to talk a little bit about your job during the day of helping grow hybrid programs. And I think you're working not just in PT, but also with OT program. So reconcile this for me and well, for the audience, really, because it would be disingenuous if I would imply I didn't have this already reconciled for myself. But I think it's a good statement to have. How do you connect a hybrid or a distance-based physical therapy entry-level education with somebody who thinks about manual therapy and is such a strong manual therapy advocate?
Yeah. So I think I've even said earlier, you think about the end game, your end goal in mind, and move towards it, right? So if my end goal is the strongest clinicians that I can turn out, it's not an academic that I'm turning out. I'm turning out an entry level doctorate of physical therapy student with a degree in a DPT. And so what does that look like? And to me, there are certain level of competencies that we would expect an entry level student to be able to do. And so certainly from a psychomotor domain of learning, we definitely want to make sure that they have the hands-on skills and acquired feedback and training that they need in order to continue to improve, whether that's in orthopedics for purposes of our conversation today. But it doesn't change, because good hands are good hands. And that's in neuromusculoskeletal, that's in pediatrics, that's in any, whether it's be specialty or system based.
It's an evaluation.
It is.
Right.
And so part of that is just really understanding the format, what can be done virtually, and being very intentional about that. And then what can be done and should be done with feedback and physical presence. Because again, we know that once we're together, there's a different stimulus that occurs. There's a lot of engagement. Again, it's energy is what I want to tell you, that it is very palpable when you come together versus maybe the online portion. And I think, I appreciate COVID for what COVID has been, which is an accelerant in learning all things in technology. And I think everyone can probably appreciate going to a conference or two, through virtual means, and how you engage is just a little different. I certainly think you can learn. but I think you don't get quite the hands-on piece. And so again, the opportunity in a hybrid format is very different than just online. You have intensive focused time periods in which you do clinical skills immersively with a lot of focused hands-on learning time. And if well done, they get a lot of opportunity to prove to themselves and to the faculty that they have the skills that will make them the right entry level clinician that the schools are very proud of.
Yeah. So if well done, what's well done? How do you make that? What's the magic sauce?
Yeah. So, I guess you go back to each institution has their vision and mission. And so what is it that they really are aspiring to see? Obviously we want them to pass boards. That's a whole level in itself. But what else, right? What else do you want? I want them to rock their final affiliation in which they are proud of themselves and those clinicians are like, give me another one. And building those clinical partners are huge. I do it in my everyday job. I work with my directors of clin ed, but I'm working with our partners, making sure that we're hearing what their needs are and collaborating with them. What else does it look like, Eric? Well, I need somebody who's going to be kind of this, master adaptive learner, somebody who's learning how to learn and keep learning. Not afraid of AI. Nope. Not afraid of telehealth. Nope. We want to make sure that they're the ones who are comfortable with their hands, comfortable with learning, comfortable with kind of engaging in this new world of healthcare and its modernization, because it's only going to keep changing, but always knowing that they have to keep patient-centered care top of mind and learning the evidence so that they know how to apply it as a practitioner. So that's what I hope to see at the end of it. And certainly competencies get them there along the way.
Yeah. So I mean, it sounds a lot like physical therapy education, right? Just maybe delivered differently. Um,
It's the same, Eric. It's the
yes.
absolute same. It's just the format is more intentional. What do you deliver online versus in person? And that is all planned well in advance.
Yeah, I always ask, a lot of people ask me this question, so I'll take the opportunity to ask you this question. Is there a student that you think like fits a hybrid program better than others? Is there a characteristic that's there?
You know, uh, I think what you may drive towards is what makes somebody successful in a hybrid program versus other. Um, I think somebody who definitely is motivated to learn does better in a hybrid environment, because if they lack some of that, it could be quite disastrous. So somebody who's a self starter, well motivated to learn and push themselves, tends to do well. We do see increased diversity, both ethnic and racial diversity, also socioeconomic as well as geographical diversities. So I appreciate what diversity comes into hybrid. I think it also challenges us in a lot of ways as educators to be thoughtful about creating a space in an environment that these students can learn to. And make them successful. But again, I think go back to like, is it grit? Is it resilience? What is it? I think it's the motivation to be a learner. Like
Mhm.
if they're coming in motivated and not expected to be spoon fed and handheld the whole time, you're going to do fine in a hybrid environment. If you need handheld, residential is an accountability resource, which means I'm going to see you 3 days a week and you're going to show up just like you do in the clinic all the time. So, who do you give a home program to and who do you need to sit with? I think
Ah,
there's a similarity, right? I think I'm
yeah.
looking at that. And so I just want to know who's the right learner that should be going in a hybrid environment, and it's a different time, different discussion. But and then what about a truncated environment? So whether that's in a hybrid environment or residential, you start truncating time, 2 years, two and a
Yes,
half
you're talking
years,
about
2 point.
accelerated programs, yeah?
Absolutely. So now you're starting to see a little bit of a difference even in those outcomes. And where's the sweet spot? So I think we have a lot to learn still.
Yeah, I think we do, and I think that's probably a whole area of opportunity for a lot of hybrid programs that are building in terms of like analysis of how they go, right? What are the outcomes and what matters and what doesn't matter?
Absolutely.
We're all guessing a little bit, really.
Well,
So
and I'll say this, and it's a pitch. Yes, I'm at MUSC, Medical University of South Carolina. I'm very proud to be at that institution. I think it's a great institution. It's a top-ranked OT program and a PT program in terms of its national ranking. But we've took that curriculum and we're providing it in a hybrid format, which means we really have to look at whatever curriculum has already been super successful and how do you convert it into a hybrid format to make sure that the curricular objectives and the outcomes are still desired or the same, but you're allowing yourself some freedoms to address for the format change. And so I think there's a there's a ton of learning opportunity right there between what gets deployed well in residential, what gets
Yes.
deployed well in hybrid, and what's the compare contrast. And so I'm super proud to be able to have brought that to MUSC, and go from the beginning to the implementation stages. It's been a lot of fun. I learn a lot, and I learn a lot about our accreditation processes on both sides, by the way. So
Yeah.
yeah.
Yeah, I think it's a very healthy thing for an institution to also develop a hybrid, program alongside a residential one, because it causes this like deep reflection moment there, and
Absolutely.
yeah,
Well, and and I'll just bring it back a little bit to Academy of Orthopedics and AOMPT. We all have accreditations, tried, true, and standards that we try to meet. And so whether it's at entry level, whether it's at residency and or fellowship, there are standards and there are things that we're trying to do. And how do you get your students to those levels? And I think as educators, you constantly have to adapt, learn, and modify. And so, I don't know, if you're an educator, there's always just this risk reward, and you gotta be okay test trialing a few things. And yeah, we're still going to keep learning. That's just the nature of the game.
yeah, I think that's a good nature of the game. Good. So, I think we're wrapping up a little bit here, and I just wanted, what else is going on in your life? So you're MUSC, but you live where? Like you're
I
traveling?
Yeah, I travel a lot.
Yeah.
So I currently live in Ohio. There's some factors that have prevented my move at this point, but eventually I'll probably head down towards the coastline, which I couldn't think of a better spot. Charleston's a beautiful area. So yeah, I'm still in Ohio. I have a daughter and a son, and my daughter just went off to college, so that's a whole new like transition in life. So I'm a mom too. And I'm a wife after 24 years, so married 24 years. So yeah, I'm trying to keep all things in balance, Eric. That's what I try to do in my every other spare moment in time.
Well, I want to compliment you because your daughter went off to college, and I saw you post a picture that she played along and did the first day of school photos,
She
which I thought that
did.
was a tremendous accomplishment as a parent to get that to happen. So
Yeah, she totally embraced it because I've indoctrinated this in their brain that mom gets the first day picture. Like that's just what we do. And so I totally appreciate her playing along. And by the way, she's at Wright State, gonna run, and just going to be more proud of where they've gotten to be. And I'll say this too, as a woman in leadership. Um, it is possible. It's hard. It's hard to balance it all, but I wouldn't change anything. I truly value the opportunities that I've had to lead and learn and have my kiddos watch me struggle and succeed. And I think there's a lot that kids learn from their parents, taking risks and challenges and working hard. So I hope that they learn that. If nothing else, I hope they learn that, despite the fact that I will always make them send me first day of school pictures. So there's hopefully more
you're like,
lessons.
mom's cool, but these pictures.
The pictures are real.
Thank you so much, Megan. I really appreciate your time today, and keep going and doing great things.
Eric, thanks. It's always a fun journey, especially beside friends. So I appreciate your help always.